You don't go.
My name is Sandra. I'm a family nurse practitioner, currently working with a HMO company, and then currently I'm seeing a lot of geriatric populations and take care of a lot of the chronic disease management that they might have, diabetes, venous stasis ulcer, wound care, where we provide a lot of wound care, CKD, CHF, COPD, and then we also manage their comedy. And on top of that, they come for wound care. The wound care can be anywhere from acute and to chronic wound care. One of my presentation, my focus is gonna be wheelchair bound patient with chronic venous ulcer. Problem descriptions is a great number of adult population is affected by venous disease. At the beginning of stages, this disease is really poses a problem, but as it worsens, it really become a chronic issue, mostly for the wheelchair-bound patient who's having difficulty to elevate the leg while they're on a wheelchair. Venous ulcer is caused by related. Propose a practice change and alternate treatment for that is to help them to encourage the member that has venous leg ulcer to elevate their lower leg, bilateral lower extremity while they're sitting in a wheelchair. A wheelchair-bound patient, their feet ended up dangle, and then therefore they have a chance to have increased fluid edema in a lower extremity. Therefore, even with the compression, the patient is encouraged to elevate the leg while sitting in a wheelchair. Presentation evidence-based chronic venous leg ulcer affect about 3% of adult populations. Elevation lower leg contribute to reductions of recurrence of the ulcer. Study shows several studies. The study show leg elevation increase. The lower laser flex flow within the vein by 45%. So therefore, by encourage these members elevate their leg, and mostly 30 minutes during the day, 3 to 4 times per day, which may be difficult for the member to follow in a routine, on a daily basis that they are going. And significant differences in avoidance of a recurrent venous leg ulcer, and even though you have to increase the leg, so there's issue with these members. Therefore, is to encourage them to elevate the leg. One of the recommendations for these members to have as soon as possible when these member comes to you is to have endovenous ablations. It's just a simple procedure, ablation of the superficial venous reflex, resulting in a faster to promote healing of that ulcer, and then provide consistent integrated care recommended to avoid injury, and then you telling these patients by follow up with you and calling you. Implication for practice: major cause of morbidity and decrease health-related quality of life. The comorbidity that this patient might have, it's patient that has a CHF, and also patient that have lymphedema in a lower extremity. And then when these members come, number 2 is to do really good wound care, not only elevate the leg or apply the compression stocking, is to remove, making sure good dressing change management by removing the biofilm, and apply good dressing to promote healing faster. And then making sure you train all basically everybody, the nurse practitioners, the RN, the LPN who's working in the clinic, to making sure everybody's is wound care certified, so that way management by wound care management it may overcome some of the problem that these members are encounter in a clinic practice, help to achieve a better healthcare outcome than those currently being observed, improve diagnostic of study. These are my references, and thank you. If you have any question, and thank you for watching me. If you have any question, feel free to add. Thank you.